most famous physical therapist on the internet.
Hi, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to go over the top treatments / exercises for a pulled groin muscle. So, unfortunately, Brad, you think you may have done this, or you're not sure?
Well, we can talk about that later,
All right.
Bob, but
you don't want to talk about it now. Okay, in case you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And generally, we're always giving something away. We're kind of in transition right now. Today, we're not giving away, if this is a Saturday video, we're not giving away something today. We're giving away something tomorrow.
Sunday night.
I think it's a TENS unit, I believe.
Yep.
Just if you want to find out, just go to bobandbrad.com, go to our giveaway section. You can see what we're giving away this week.
What we have given
or
away.
next week, what we're giving away.
Sure.
Or go to Bob and Brad Facebook. It's always pinned at the top of the page. All right, Brad, so what are you going to reveal now, or what?
Well, the groin injury is a pretty commonly injured problem. We have, people requesting some videos on it. We've done a few in the past, but we got some new exercises this time.
Gotcha. And I think you see it a lot of times in soccer players, especially with the lateral motion that they have to do with their legs.
Right. So, the groin injury is your adductors. It pulls your leg in or across, going this direction. So it's the muscles right in here.
Yeah, they start down here and they attach up into the groin. So that's why people think a lot of times it's I don't know what they think they're pulling, but they're pulling a muscle.
Right. It's into the pubic bone and over. So it's one of those things that's very painful.
Yeah.
I've pulled mine just running.
Oh, have you really?
Yeah, right. Not that seriously, but
sure.
I've done that particularly in the spring when I haven't been running all winter. When I wasn't a treadmill runner and I go out and run. But it did, when I was older, I was over 50 and that heart started. You know how the aging thing goes.
With the aging thing, it doesn't take much anything. You get out of bed and you pull a muscle.
Anyways, if you do have a pulled groin, I see a lot of videos and I hear a lot of people talk. Stretch it, get that stretched out, and that's the last thing you want to do right after you pull it. If you pulled it today, you're not stretching it today, you're not stretching it tomorrow. You're going to wait until it feels better. It may be a few days. So do not
You got to start allowing that healing process to occur.
Right. You got the inflammation going on. So you're going to take a cold pack, get in a recliner, relax, read a book, and get that cold pack on there and just let it settle down, get some ibuprofen. Again, this may be a 2 or 3 day process depending on how severe you pulled it. If it's just a tweak, you may be stretching it within a day or two maybe.
Now the body's trying to heal it, and that's why it's sending in all this fluid in there to help heal the tissues, but it overdoes it.
Right.
And that's why we use the ice and the ibuprofen, because it goes a little crazy.
Yep.
So.
And once you get through that phase, after a day or two, possibly 3, then you're going to get into that muscle and you're going to feel if there's any tight spots, because sometimes a muscle will respond to an injury by getting a knot or tightening up. And you really need to get that loosened up so that you can get circulation into the muscle and those injured tissues can heal more rapidly. So you can simply get in with your fingers. And I did notice this. I had a pulled muscle groin. Well, it's a long story, but I could feel clearly a knot. So I start working it.
Sure.
And again, I was just in my recliner, relaxing, and I was able to get it to relax and loosen up until that muscle is pliable.
He's going across the fibers. The fibers run this way. He's going across them.
Yep.
He's going pretty deep.
Right.
And the thing is, even if there's not a knot there, let's just say there's a lesion, there's a tear.
Sure.
You want to do this because it's starting to form scar tissue.
Right.
And you want to get more blood flow to the area, so you do want to do the massage.
Right.
No
and you're gonna do this for a few minutes. Your fingers are probably gonna get tired. If it's really tender and it just gets worse, it means it's too early. Get the cold pack back on it. But otherwise, you're gonna get in there until your muscles are tired, and you'll shake them off, and that'll be good for a while.
And you can try one of the handheld massagers. We like this one. We've been starting to use this Remfo one because it's less expensive. It's only $40, and all the other ones were like $100. And we thought, what a great device. Does the job. Comes with different heads on it, and it can work. Yep, just spins right off. So
So that's an option. Otherwise, use your hands.
We'll put a link below it's in our favorite products, I believe.
Sure. So once it's starting to feel good, you're walking without pain. You can go up and down steps, without pain. Then you can start your stretching. This may be 3, 4, maybe a week later. And one of my favorite things to do that is a really passive way to get things moving. Go to a stairway or get a step, get something to hold. I got the, what do we call
The
it?
booyah stick.
The booyah stick, or if it's in a stairway, get a hold of the rail, which works really good, and just let the leg relax.
So that's the injured one is your left one, Brad.
Right, my left
This one right here, yeah.
And I'm just going to swing it forward and backwards in a really
gentle, yeah.
relaxed. And if this goes good, then you're going to go right and left, because this is the way it's going to be a little more sensitive if it is. And if you can do this, swinging it back and forth, so it feels like it's starting to loosen up and it's pain-free, then you can start to get a little more aggressive with the stretching.
You see a lot of athletes warm up this way.
Yeah.
It's active stretching in a sense. But you really want to emphasize here is that you don't want to feel any pain with this, and you don't want to go too far to start off with. It's just a gentle way of starting. It's just like the shoulder, pendulum exercises. You're just trying to get some gentle movement there without injuring it.
So the next one, you're going to have to move, Bob.
Sure.
This is a nice way from the pendulum, the next stretch. Everything's going good there. You can swing. You're not going to swing really aggressively on that. Maybe at the end of the rehab. But this is a nice way. You can take, we got the stretch out strap here, put it around your foot. Let's say my injured side is the right one.
Some people actually use a dog collar.
Sure. I've got another option here too. But, this is nice because you can grab it like that, and I'm going to double that up. And you're going to lift it up, and then you're going to stretch out to the side. Now, if we had a camera from the top view,
sure,
I'm stretching the adductor out to the side, and that's the way you can stretch it. You can go way out. I'm getting a nice stretch here. Of course, this side is not pulled. If you were injured, you may only go half that far, but then you can work back and forth. If you don't have one of those, but you have a cane, like this, that works pretty good. You can put that around your foot and take some of the weight off and stretch it. Now you can do this on the floor, and it's nice on the floor if it's a hard floor that's slippery and you can just slide your leg
like
across.
a wall angel or like a floor angel.
Yeah,
right?
Yep, exactly. Okay, the next one you can do when that feels good is the clamshell. Just get in the hook line position, I call it. Feet together, knees together to start with, and just allow the knees to relax and go out. And you can, put a little passive range of motion with your hands on your knees. You can work one side, the
Again,
other
let
side.
pain be your guide.
Yes.
So
you got to remember, you got these are the tissues that were pulled. They want to get them to heal and stretch nice, but you don't want to rip them apart and start all over.
You want to have them healed, lengthened, as we say.
Right.
But you don't want to have them re-injure again.
Exactly.
So
these stretches, you're going to go pressure on, pressure off on that cadence 10 times. Or if you want to do a 15 to 30 second hold, really relax and remember to breathe and relax. Monitor the pain level. You're not getting into any sharp pain. And then the next one is
on the stairs?
On the stairs, or you want to show the one on the knee?
You can go ahead and just kneel. If I'm stretching this side here, you can just go ahead and bring it out like this. And you can lean forward over to this side, and you can start to feel the stretch here. Yep. This might be a little aggressive for you to start off with.
Yeah.
I mean, I like the stairs you can put it on the lowest step first.
Sure. Yep.
Yeah.
Here.
You put it there, and see how you do with that, and then you can work your way up. And a lot of times you have the railing of the steps to hold on to too, and so it works out really good.
So you can do this, or you can drop this knee and stretch that way as well, and you'll feel that stretch in that groin area. And again, pressure on, pressure off, and repeat that. Or you can go just hold it for 15 to 30 seconds. Breathe, relax, let the muscle stretch, not too hard.
But again, notice we went through 3 steps before we began stretching.
Right.
So it was held. We held off here.
And then finally, one thing you can do, I like, is to get some resistance. A beginner way to do it is get some banding.
Yep.
And you got to find a way to attach it to the wall. We got our handy dandy wall anchor there. It fits right on there. And usually they'll give you an ankle clip here. And then you can start to strengthen it this way. Now I'm going to suggest this is strengthening the adductor muscle. But I'm going to suggest do 4 directions and get the whole hip. Because it's been injured, the whole hip needs to be
the whole hip is probably
rehabbed.
going to be weaker.
Yep.
Because you've been protecting it.
Right.
And when you protect one muscle, you're protecting them all. So he's going in all 4 directions: abduction, adduction, extension, and flexion.
And I'm going to recommend the goal is 30 seconds of repetitive motion. Should be pain-free. Should just be fatiguing the muscle, getting it tired. And make sure you do it on both legs. Take the strap off, do it on the other leg so that both legs get the chance to work. It's going to help your proprioception, get you back into your sport, and be at the top of your game.
By the way, if you do decide you want to get a wall anchor, get it from our website because you'll get 1 extra one. Normally you get 3 and free shipping from Amazon.
Yep.
Which is still us.
Right.
But if you go to our website, we'll give you 4 and free shipping. So it's a better deal. And you can use them all over the place for strengthening. So
there you go.
All right, Brad, you got anything else to pipe in with?
Nope. We can get a little more aggressive, but that's going to get you the rest of it. At that point, you can start jogging, you can start running, working some lateral motions right to left, but do not go too aggressive too fast.
Yeah, you're going to work onto that very slowly. You don't go out and run 5 miles the first day. You just take
no sprints.
Yeah, you jog to the end of the block and see how you tolerate it, and probably some walk jogging.
Right.
Do some walking, do some jogging. So
we'll have to do another video for advanced strengthening for this, perhaps.
That sounds right. Thanks for watching.